Hi, my name is Sandra Fulton, licensed clinical social worker at Adventist Behavioral Health, and today we're going to be talking about the signs, symptoms, causes, and treatments of depression in senior adults. More than 2 million of the 34 million Americans ages 65 and older suffer from some form of depression. And although seniors comprise only 12% of the U.S. population, people ages 65 and older accounted for 16% of suicide deaths in 2004. Depression is not a normal part of aging. Knowing the causes of depression and recognizing the symptoms can lead to earlier diagnosis and more effective treatment. And the most important piece that I want to emphasize is that depression is a treatable disease. On the next few slides, we're going to talk about some of the different causes of depression. And the thing to keep in mind is that each individual is unique, so for different people, depression is going to be caused by different factors. Some factors include health problems, illness, disability, severe or chronic pain, cognitive decline, which is a part of normal aging, and change to body image due to surgery or disease. Another cause of depression is loneliness and isolation. Many seniors live alone, have lost spouses or family members, and so they have a dwindling social network. As we get older, not only do we lose family members, spouses, but also friends. There's also decreased mobility due to not being able to get out as much due to either illness or loss of driving privileges, and a reduced sense of purpose. Feelings of purposelessness or loss of identity due to retirement or physical limitations on activities. Some other causes of depression include fear of death or dying, anxiety over financial problems, and fear about health issues that are developing. Also, recent bereavement. Again, this is a big factor with our seniors. The death of friends, family members, pets, the loss of a spouse or a partner, lack of emotional support network, and family history or previous history of depression. Next, we're going to talk about signs of depression. And again, just as I said with some of the previous slides, this is also something that's going to vary and be unique with each individual. Some signs of depression include lack of interest in normal activities. For example, somebody who may have enjoyed going to church suddenly doesn't. Somebody that used to enjoy going to different social support groups suddenly loses interest and becomes more isolated staying at home. Loss of appetite, and not only loss of appetite, but we also sometimes see the other side where there's an increase in appetite. Prolonged sadness and feelings of loathing, not liking oneself. Preoccupation with death or thoughts of suicide, and prolonged fatigue. And one of the things we often see is not just a decrease in sleep, but also an increase in sleep. Other signs of depression can include substance abuse. Not just alcohol abuse, but also what we are seeing more and more of is prescription drug abuse in our senior population. Sleep disturbance, both increase and decrease in sleep, as well as persistent help-seeking behavior. So for example, somebody that continues to complain about particular ailments and nobody can find the reason for those ailments, that can be a sign of depression. Many individuals that suffer from depression may be viewed by others as their depression being caused by a character flaw or personal weakness. And they may also believe that an individual should be able to just snap out of it. All of these stigmas can lead to a delay in diagnosis and treatment. And also for an individual who may be suffering from depression, they may be also feeling these same stigmas, that there's something wrong with them for feeling depressed, and out of a sense of embarrassment, delaying diagnosis and treatment. Some other stigmas of depression include the fear of being excluded by others and the fear of being viewed as crazy if one is diagnosed as having depression. The important thing to remember with all of these stigmas is that we know that these are false and untrue. Depression is a mental health condition that requires treatment. Our next few slides, we're going to talk about ways to prevent depression. The most important is adopting a healthy lifestyle, eating right, getting exercise, and getting plenty of rest. Staying active, finding a hobby, socializing with friends. One of the best things that exists for seniors is senior community centers, which exist in every county and are a great way to increase that social support network. And having regular checkups with your doctor to detect underlying medical conditions that may increase your risk of depression, and developing a social support network, again through senior centers, through church, through support groups, or through other various activities that you may enjoy. It's very important for senior adults to remain socially active and seek support from family and friends. And for those that have family members or friends that are seniors, it's important to periodically check in on those that are living independently and really initiate conversations on maintaining overall health and wellness and keeping those communication lines open. There are various methods used to treat depression, including medication prescribed by your family doctor, physician, or psychiatrist, in conjunction with therapy. Therapy can often be helpful to help treat the underlying conditions that may be contributing to one's depression. Being aware of supportive interventions, the importance of keeping that line of communication open with the seniors in our lives so that they know that they have someone they can talk to if they need to. Being aware of resources within our community. For example, the library has numerous books on depression, treating it, the causes, recognizing the symptoms, and also being aware of resources within our own community. For example, in Montgomery County, there is an aging and resource line that can be used to access resources specifically for seniors. And also being aware of group therapy, which can be especially helpful for somebody that may be experiencing depression because of the loss of a loved one. They may find a bereavement group to be helpful, or someone that may be feeling depressed because of a specific medical illness may find a support group that deals specifically with that medical issue. I'd like to take a moment and just talk a little bit more about the treatment of depression in therapy. The most popular therapy used to treat depression is cognitive behavioral. Cognitive behavioral therapy works on helping a person change the way that their mind is thinking as well as their behavior. For example, many individuals that experience depression have what's called a negative thought pattern in their mind, where they're constantly telling themselves negative things about themselves, and helping them break those thoughts can ease their depression. Interpersonal involves one-on-one talking with a therapist about what's causing your depression and just working through the feelings. Problem solving. Problem solving is for seniors who may be experiencing depression because it's related to things such as financial difficulty and helping them problem solve how to better handle their finances. Or a senior who may be feeling depressed because of the loss of a loved one, helping them problem solve how to work through those feelings. And psychoeducational, which involves more educating the person about their depression and the physiological aspects of it. If you are concerned about a loved one, or if you as a senior are concerned about yourself, please contact Adventist Behavioral Health's Needs Assessment Department and request a behavioral health consultation. You may also complete an online assessment request on our website. And in the case of an emergency, please head to your local emergency room. Adventist Behavioral Health has a specific unit called the Magnolia Unit, which is geared for seniors ages 60 and older that may require inpatient psychiatric hospitalization. The unit works using support and therapeutic interventions for our seniors that may be living in the community or in assisted living communities. Adventist Behavioral Health also has outpatient programs that can be utilized for individuals that may not require inpatient psychiatric care, but could benefit from further support and therapeutic interventions. If you would like additional information, please feel free to join us on May 24th from 12 to 1 p.m. for a live chat where I, Sandra Fulton, will be available to answer any questions you may have. Thank you.